is you actually may like it. You might just think you're going to try. You actually might like that substance. You might actually like smoking that cigarette for whatever that reason is, and you may not be able to get off of it when you choose to do so. So then you become a slave to these items. Especially some drugs, you become a slave to it, and they're very expensive, and then you start doing behaviors that you probably ordinarily wouldn't have done. And then you become a slave to these substances. So what we're saying here today is that when you love yourself, you will not allow toxic substances into your body because you don't know, or you can't predict the outcome of these substances, and they might take a certain path that you never could have possibly predicted. But enough about what I have to say about all this. Let's take it to the streets and see what other people have to say about it. So today we're here with our special guest, the director of STAR at North Kingston, Frank Spicola, and we're going to continue our discussion on do not put toxic substances into your body. Can you give maybe our audience today any insight on why people start doing that to begin with? And
Well, I mean, I guess you're referring to children or adolescents.
Okay.
When you get started. Basically, some of the age-old reasons, peer pressure. Certainly that has something to do with why adolescents or children, do things. But there's also, curiosity factor, and there's availability.
Okay.
Prescription drugs abuse has gone up in numbers in the past 10, 15 years.
Very interesting.
And basically, a person may just have some depression or other mental health illness and trying to cope with that too. So there's different ways, someone will get started. But basically, what I see here, mostly people start with, the gateway, substances, marijuana and alcohol. And when I say gateway, I mean that, my experience is that people that move on to other substances such as heroin, cocaine, they start with marijuana and alcohol. It doesn't mean that everyone is going to move on to that, but it certainly is. You could say it's a gateway process because as a person gets used to, first of all, they have to break the law, for example.
Okay,
drinking,
right.
They get used to that, and sometimes the next step is not as frightening to them.
Oh, I see. So it's kind of an entry-level gateway. I see what you mean by that.
My experience seems to be that way.
Maybe, do you have any advice that you can give to parents? Because I know some of this, like you said, starts younger as teens. So let's start there, for example. Do you have any advice that you can give to parents or the teens surrounding this issue?
It's tough to give advice to teens, is it not? You can. But parents, basically, it's been my experience that prevention is very important. Whether prevention works or not, what side of the coin you're on about prevention tactics, once someone starts abusing, substances, the rate, the ability for that person to stop and get in some type of recovery seems to be a lot more complicated, more difficult than, providing some prevention information to children. So basically, for parents, I would say, just be aware of your child's behaviors. If a change in behavior could be just growing up, or it could also mean that they've changed their friends, for example.
Okay.
And be aware that prevention, as I said in the beginning, is a lot better. In some cases, facilitated easy to help with prevention than actually trying to get someone to stop at a later date. Okay, so
in prevention, you're talking about what specifically? Educating them on the bad effects of drugs? Like, what would you say parents should do to prevent or try to prevent?
Well, when I talk about prevention, I also are including the parents. But we first start out with, you talk about the substances, how bad they are for your body. So you do go through that with, with youngsters and adolescents and teens, and and it's been my experience that it's difficult to scare someone that starts using once they start, but you can warn, youngsters that, the negative consequences of drug use. But parents also it's been a movement in this state, in Providence, where parents educate parents so that, their prescription drugs, if they get some painkillers, for example, and they don't need them anymore, discard them. And there are proper ways of doing that. They actually had last week or the week before, they had a bring in your prescription drugs to a spot, and we'll take them, dispose them for you. And I believe statewide, I guess you're gonna quote me, because 2,000 pounds of prescription drugs.
Oh, okay.
Statewide. So it's also educating the parents, about, if there are examples of maybe your child hears you, is listening to you when you're talking to a neighbor, and your neighbor might say, I have a headache, and you might, parent might say, well, I have some leftover medication, pain meds, which seems innocent maybe enough in itself, but the child hears that. And,
I see. And you never don't know what they'll do with that information.
And say, well, I guess if my parents do, I guess it's okay. Perhaps, that's just one area.
Okay.
So it's prevention and education on both sides, and then there's also there are other prevention methods like, there's a movement with some athletic clubs where they're getting some teenagers and youngsters, to say run races, so they train, together with a facilitator, and build self-esteem, because a lot of times it is about low self-esteem.
I see. Why they start to begin with.
Yes, a lot of times.
So here's a question for you. A lot of people say that many teens start with drugs because of peer pressure, and they have the need to feel accepted and to have friends. From what you've seen, these people that are addicted to drugs and that are struggling in rehab, which sounds like it could be potentially very costly and affect your life. Do these people coming in, do you feel like they still have these friends that they changed their whole life to have? Or are they now not, is it a way to gain friendship, is what I'm saying?
Well...
Or do they have their friends, or they're, after they've done all these drugs and they're now addicted, or are they really still left alone and now they're struggling? So it's really not a good option for kids to look at that as a means of gaining friends. Does that make sense?
Yes. It's been my experience that when a teenager, whatever age, starts to experiment and use, illegal substances, that they will get new friends that do that.
I see.
And the old friends that are living a maybe more positive lifestyle will drop off, and by the time they're an adult, I can tell you many times I've experienced as a clinician where a client would, almost come to an argument about how, they need to hang out with their friend because, they don't want to change their friends, they grew up with them, but then they come to the realization, almost invariably, but I can't say that, exactly, that they don't have any friends anymore.
They don't. So the whole reason they did it to begin with, to make friends, in the end they don't have friends anyway, so it's not really worth it, is it?
Well, in that case, no.
Frank, that was very interesting what you're saying about why some people start, different toxic substances to begin with. It could be because they're being bullied, or they might experiment and not realize that they're going to like it and get hooked, or their body chemically gets hooked to it. What about alcohol? Do you find that some people do that because they're shy and it gives them a sense of confidence? Do you have any comment on that?
Yes. Alcohol is a depressant, and it depresses inhibitions. That's why, you might see a scene of somebody at a party dancing on a table with a lampshade.
Oh.
It depresses inhibitions in a way that you have your feeling part of your brain, to be very general, your thinking part of your brain, and in between we'll say there's a switch or a filter. Alcohol can wear away the filter, so you might be able to be less shy, in a situation. And it's no surprise that it's called a social lubricant, because one drink can be social, but when a person gets used to the lack of inhibitions in day-to-day life, either because they're shy or because there's a chemical reason for for them to continue the use, it becomes habit, and habit is very strong. So in other words, if you're starting high school drinking before a dance, you may think that you need to drink before every dance, for example.
I see.
So yes, it does have that allure for youngsters and teenagers that are shy in social situations.
But then you might end up doing things that you wouldn't ordinarily do that you're going to regret the later. So that's part of the
Yes.
downfall. So it's a fake confidence that might make you do things that you wouldn't ordinarily do.
And you don't need to be an alcoholic to get in trouble.
Okay.
You know, you
right.
get drunk one time and get in trouble. So, you know, we're talking about alcohol dependence, abuse, and also just, you know, misuse on one occasion, you know. So, you know, you're quite right. The negative consequences far outweigh, you know, the positive aspects if you're abusing it.
Okay, so what then is a good alternative for people that are shy? Instead of using alcohol, for example, what's a good alternative?
Well, you know, shyness is, you know, it's fairly common. You know,
Oh, okay.
and there's levels of shyness. You know, there's, you know, we're not talking about social anxiety. We're talking about being shy. You know, not knowing if, you know, the person you're going to ask to dance at a high school dance is going to say yes or no. I mean, that's
It's okay
life.
to be shy.
Yeah, of course. I mean, you know, now if someone has social anxiety, that's different. Then, you know, you might seek therapy.
A therapy. Okay,
You know,
that's very good advice. So there are other more constructive ways to handle, you know, loneliness or shyness or something like that then.
Sure, and like for example, shyness. You know, if you question yourself for your shyness in a school type atmosphere, you might be more prepared for an assignment. For preparation can help with shyness. For
Oh, okay, good.
preparation. You know, but basically, you know, youngsters they're negotiating the world. You know.
Okay.
You know.
All right, that's good to know. Good advice. To think. One thing you had mentioned earlier is that, you know, people get hooked on drugs and, you know, hooked. Now, to really understand what that means, my understanding is that some of these chemicals, including alcohol or some of the over-the-counter medications or prescription drugs, actually chemically alter your brain. It actually chemically alters it. So now if you take away that substance without professional help, like you were mentioning with alcohol or something like that, all of a sudden your body's looking for something that wasn't there, and it's very dangerous. And that's why you get side effects in some of these cases, and that's what being, quote, hooked on means. You're chemically hooked on it, and you need professional help to actually help your body make new adjustments. Is that correct?
Well, for alcohol and drugs
Some of
like
them.
Valium, you know, benzodiazepines, Klonopin, Xanax, it can be lethal to stop abruptly. You can have a seizure and die, and it happens. You know, it hasn't happened. It's died. It hasn't. You know, but there's you know, a true potential for that. Other substances like heroin, opiates. You know, there's maybe no cases of people dying from withdrawals, although there may be. So I don't want to be unequivocal because, you know, there are cases in Europe that they talk about. But basically, your brain is so used to getting the chemicals, as you say, that the brain stops making it. So if you had chemicals, for euphoria, or for, you know, if you bang your thumb with a hammer and it gets numb for a few minutes, that's your body producing its own, you know, its own painkillers, so to speak. Well, if you introduce that to your body in massive amounts, like heroin does, then your body's going to stop. So when you stop, the body's going to grab the chemicals from everywhere. That's why you have sore joints and you can't sleep until the body can start producing the proper chemicals itself.
So it's very dangerous to just take drugs and then stop when you feel like it without proper supervision.
Yes.
Okay.
The only kind of advice that I could give in a general statement is that, you know, negative consequences of substance use disorders are not only, you know, debilitating and rampant, but they lower the quality of someone's life. And it can be as low as living in an abandoned building and, you know, eating, you know, at a soup kitchen, you know, eating at hospitality sites, as they call them now.
Okay.
You know, basically, it takes a lot of effort,
Right.
you know, to change. Like human beings in general, you know, are not conducive to change.
Well, I want to thank you very much for joining our show.
Thank you.
It's been an honor to have you on our show. I appreciate your time. Thank you.
Hello, I'm with Angela. And Angela, our special topic is do not accept toxic substances into the body. Now, what do you have to say about that?
Well, I'm a recovery addict, so, you know, I put toxics into my body, and, you know, I feel very, like, depressed a lot, very anxious. Like, every time I get upset, I just want to go out and get high. And that's why I think a lot of people do get high. It's because they're either depressed or, you know, they have no place, they have no family, they have nobody for support.
Do the toxic substances help the person?
At some point, like they basically, it puts like a Band-Aid on it. It covers all your problems, but it doesn't help. It makes life even worse, more harder.
So it helps temporarily?
Yeah.
What are some of the consequences for people who take toxic substances into their body?
You can die, overdose, you lose your family, you lose your children, become homeless, you lose everything in life. Friends, everybody. And now you're alone.
And what about health-wise, your body?
Body basically shuts down. You go through the shakes, you get the shits, the pukes, everything.
So your body is essentially rebuking it.
Yep.
What advice would you give people out in the community about taking toxic substances into their body?
Don't do it. Seek help from a professional or a therapist or someone else. Because that's what I have done.
What are some reasons that people turn to toxic substances?
Domestic violence. You know, being molested as a child. You know, they just want to, even people that drink, they want to just cover it up and try to put it in the back burner and not remember it at all.
So it starts from an early pain early on in childhood,
Yes.
possibly.
Yep.
It comes back to their mind as an adult.
And they just want to forget about it. So they go and they get high or they drink and they don't even think about it. That's how I was when, you know, my past came up. You know, I just wanted to go smoke weed or do a little coke here and there and have a few drinks. You know, that I would not even forget about it. I mean, it wouldn't be coming in my mind. It'd be gone. And then I got hooked on it.
Oh, Angela, what did you not get as a child that made you turn to drugs?
More support. We need like more teen centers. You know, more programs for kids to go to hang out when they have no place to go, when they're bored and they just want to go get high. You know, we need some places that have like pool tables, art therapy, counselors, places like that. We need more places like that that provide help, provide, you know, someone to talk to 24 hours a day, like a hotline, but a person there. That someone can just walk in and say, I'm having a bad day, I feel like going to get high, can we talk? You know?
That's great advice, Angela. I've heard that from other people in your situation, that they wanted free counseling and it wasn't there.
There's no insurance. The insurance don't cover a lot of counseling.
Angela, you said you were a former addict, so do you take drugs now or not?
No. I've been clean for 3 months.
How did you conquer the drugs?
Going to NA meetings and the 12-step programs. And looking at my daughter's picture every single day.
AA meetings?
Yeah, sometimes I go to AA, but it's NA.
Oh, NA.
Narcotics Anonymous.
Anonymous. And
It's the Narcotics Anonymous 12-step program.
all right. And that worked?
Yeah, I go every single day. Monday through Saturday.
All right, well, that's great to know. And you said looking at your daughter's picture
Every
helped
single
you?
day. Yep.
All right, well, that's great. Thank you for this interview, and good luck with all your endeavors in the future.
Thank you.
Well, as you heard from all of our special guests,